Hello, everyone. This is Mark Anthony with EdgeOnRegenShow.com, the place where we bring you the best of the best doctors in their area within their niche or niches. Today, I have a special guest, a friend, Dr. Jeff Frost, here with us. He is at azregenmed.com. When you're in Arizona, make sure you go to azregenmed.com. Today, we are going to be talking about TRT. You're probably, what is that? Is that a rash? No, it's not. Testosterone. We're going to be talking about why men and women need TRT. And if you're not feeling that extra maybe you're in your late 30s, 40s, 50s on up, and you just feel like you need to get the spark plugs changed, you might want to take a look at this. A little bit about Dr. Jeff. He is, hopefully I'm saying this correctly, he has over 29 years of experience as a chiropractor. He is also the owner of AZ Regenerative Medicine. .com, or as he said, it's azregenmed.com. Also, he's an expert witness in the field of biomechanical correction and the restoration of the spinal column and its related complex. Dr. Jeff Frost has been part of Kiwanis, same here, and the Rotary Club and Fellowship of Christian Athletes. Dr. Jeff also enjoys jogging and running, water and snow skiing. Now, mountain biking and road biking and cars and spending time with his family and pets. Sounds a lot like my life. But just wanted to say thank you so much for being here, Dr. Jeff.
My pleasure. Thank you for having me.
Yeah, awesome. I hope you loved the long 1980s intro. I had to do that. I've been feeling a little nostalgic. So tell us a little about, before we go into why men and women need TRT, tell us how you got into this practice of chiropractic and medicine.
Oh, that's 30 years ago. And basically very high level. I grew up in a world where everything was kind of natural, vegetarian, eating well. I went to a school that was well-rounded. They taught me how to garden and can and do all sorts of natural ways of healing and helping people with hydrotherapy and massage and herbs and stuff. And I decided to go into chiropractic instead of a mechanical field, because I love mechanics, because it was just something I grew up with and realized it's a gift, and I think once you realize your gift and you can tap into that, you're not just good at it, but you enjoy it. It's not a job, it's fun. And so I got into it for all the right reasons, and happiness, definitely.
Now, awesome. So you got me excited. You mentioned pets, so I'm a dog lover. What type of dogs do you have as kids?
Sure. So we have a Shih Tzu and a Shih Poo, which is a Shih Tzu Poodle mix. We just acquired a Labrador, a chocolate lab. She's 12 weeks old now, and then of course we always, horses are always fun, so we got a Great Dane.
Oh, nice.
Yeah,
that's awesome. Yeah, I have a miniature Schnauzer. I'm just a Schnauzer lover, full breed, white, blue eyes. She got me at the blue eyes. And now my wife's like, okay, we have 3 people in the bed now. But hey, that's okay. I was like, she can't sleep on the floor. She's like, she's a dog. No, she's my daughter. I'm sorry. She was like, okay, Mark, you're taking it too far. I go, hey, I prayed for daughters. I didn't get any. So, hey, I guess God gave me a dog girl. So I'll take that. I'm kind of weird like that. But hey, so let's talk about this. Your thoughts on, before we get into why men and women need TRT, what really is testosterone? We see that there's a lot of stuff on Google. A lot of people are saying that it's bad. It could cause cancer. I mean, you know how it is when people get on Google, they just type a bunch of stuff and everyone's a doctor within 24 minutes.
Right. Dr. Google can be dangerous or helpful. It depends on how you can balance things out. And I believe that 20% of the people create 80% of the problem. So be careful of the falsehood out there. If you learn truth, then you'll know what falsehood is. So I tell people, just, focus on the truth, gather your data, prove all things. With testosterone, it's a hormone that you create every day, men and women, both balanced according to their gender. But you also have to look at the other hormones, estrogen and progesterone, thyroid, All that plays a role in balancing the human life. You know, when we're young, before we reach puberty, all the hormones are pretty similar, you know, and balanced. And then once we, reach manhood or womanhood, those things start changing into the direction that we're designed and created to be.
Mm.
Um, Testosterone starts going up in men. They start developing in different areas, muscles, endurance, and strength. Women who don't want so much the testosterone, they get into the estrogen, progesterone in order, for the development of children and the fallopian tubes and having children. And so these are key throughout your whole life, even if you're not producing children, as a woman and as a man, even if you're not in the football, if you're not in an NFL or hockey, stuff like that, where that testosterone and endurance and vigor and strength is important. And so when it comes to testosterone, a lot of people don't realize that things start diminishing as you get older. We talk about regenerative medicine. Same thing happens with testosterone with a lot of men, a lot of women.
Mm-hmm.
And women don't realize that the testosterone is important for them as it is men. It's just in a different direction. Men and women can both suffer from fatigue, lack of endurance, not being able to sleep properly. Even in the bedroom, men and women both can suffer in this area. It's not just men.
What would you say that you've seen the most, maybe 3 top signs that you might be, low testosterone levels?
Well, signs are even, I look at the age, because we do, as we get older, men do need less testosterone. Usually, when, we're under 50, we look at a testosterone level of anywhere from 800 to 1100. But when we get to be 60, 70, 80, we look at anywhere from 600 to 800 as normal. One of the signs that I had, because I did suffer from this and didn't realize it, fatigue, tiredness. Mark, you got to know me a little bit, and I'm a type A personality. I could work 10 to 12 hours and, life was still good. Go home and, handle the kids and go for a jog and everything else. And people don't realize that they start suffering from low T. And they start looking at, their lifestyle, their stress level. They look at, exercising. They look at lack of sleep, stress on the job. And a lot of these are all very common for everybody. Nobody is immune to them. Mm-hmm. What ends up happening, and it did with me, was I just got burnt out, and I didn't understand why, because that was not normal for this man. And so I think that, if you're tired, you're fatigued, even if you get plenty of sleep, you take a 5-day vacation, 7-day vacation, and you're still not restored when you go back, you might want to look at some of these other areas chemically that you can't diagnose yourself.
Wow. So I from what I've heard is that this could also even start in your 20s. So yeah, I mean, everyone's saying in their late 30s, 40s, but even in your early 20s, I've heard of people having, very low T.
Yeah, that's correct. So when we're younger like this, when we have low T, we also want to look at other complications. Cholesterol. A lot of people think cholesterol is something that, oh no, you got to get rid of the cholesterol. I got high cholesterol. They don't realize cholesterol is normal. And if a youngster has low cholesterol for genetic reasons and or dietary reasons, they might be changing or their diet and or suffering because they're putting toxins in their body that are suppressing this. They need to at least get tested, at least get a blood test and just find out. Dr. Google can't tell you. We can turn around and we can ask all the questions we want. And we can answer all the questions that we're asked, but you don't really know until you objectively go in and see what is. And with testosterone, people don't realize that there's multiple things. It's not just testosterone. There's different parts of the testosterone you have to look at. So some people might just say, well, what's your testosterone level? Well, it's 900. Yeah, but what's your free testosterone? What's available to you? So now there poses a question. So your testosterone can be normal, but if you don't get to those little detailed subcategories of
Mhm.
testosterone, no different than a thyroid. You
Oh,
got to look at
wow.
the subcategories, and you got to test all of these and see what's going on. What if your testosterone is normal, but your estrogen is too high? That's out of balance. That can have adverse effects as well. And this can happen at any age. Any age. We just look at the older folks, because folks, just as been pointed out, we think 50 and above, right? No, I've got people that come in I got a guy right now, he's in his 40s
Oh,
and
wow.
he's having a hard time with ED. He's having a hard time keeping his work pace and his family life balanced with everything else he enjoys doing.
When you said ED, what is that?
Erectile dysfunction.
Okay, so I'm gonna go up on a shot. So something like that would of course help, maybe like a pea shot.
Can, did you say a pea shot as in
Yeah,
papa?
yes.
Yeah, it can. Again, you have to do the proper diagnostics and find out what is the problem.
There we go.
Are they having cardiovascular problems? Because
Exactly.
in the men and the women, and the O shot, you got the O shot for the women, same thing, right? So those areas of the male and female genitalia, they're sensitive areas, and if you don't have enough blood flow in there, you're not going to be able to perform as you normally used to prior to that ever occurring. So again, you could have a cardiovascular problem. You got to look at also the nervous system. As being a chiropractor and a spinal expert, you got to make sure that nervous system is functioning properly in the lower back, so the brain and the body can communicate right. So the body says, "Oh yeah, we're doing this," and the brain says, "Oh yeah, I feel that." And versus, "Yeah, I'm not feeling much." It's like, no, I'm not getting any sensitivity in here because there's a blockage in the nervous system as well. I'll tell you a story. There's 20 years ago, in my clinic, I had a woman who was coming to me, and they were in their 50s. This couple, a woman was coming to me for a personal injury case. I was working on her stuff, and the dad came in, and the husband came in, and he said, "Hey, can I talk to you a minute?" So of course we privately went into a room, and he shared with me that he was having a problem in the bedroom. And he says, "Do you think you can help me?" I said, "I'm not quite sure," and I wasn't doing testosterone and hormone replacement, but I knew the nervous system. And I said, "Well, let me check you out." So I found out that his L3 nerve root vertebrae was
Mhm.
not functioning properly and could be causing an issue. And I told him, "I don't know if this will help, but let's see if we can at least free up the nervous system. If this is the cause of the problem, let's see if it'll fix it." And so he said he agreed, and we did our thing. We adjusted and we got the nervous system functioning properly again. And then the next time they came back, they were both smiling. So, there is something to be said with doing proper diagnostics and finding out the cause of the problem before just going after what Dr. Google or my buddy said.
I like how you're detailed, and I like that, because and I'm not. It's just kind of like this, not all doctors are equal, and not all pizza is equal. It's, you never know what you're going to get. You can get the $5 pizza, or you can get the $20 pizza.
Yeah.
I'd rather get the $20 pizza. I'm into taste, but hey, to each his own. Where I'm going with this is that it's interesting, because some doctors will say, "Hey, you know what? It sounds like this. We'll give you this."
Very common. Oh,
Right.
yeah.
But what I like, which you're in I call it the 3% percentile, is that just because I come in with, let's just say, a neck problem, my neck's hurting, it doesn't necessarily mean it's my neck. It could literally be something that's connected to my shoulder, or the problem's happening somewhere in the lower back. I'm just saying, like,
Yeah.
it's like, well, I need to treat my neck. No, we need to treat here first before we get to here. I'm just saying, like, it's going, where is the root cause, so we can get that taken care of. At least that's what I hear you saying.
Yeah, absolutely. I've got a patient right now. And unfortunately, in his young life, he lost the ability to develop testosterone. He lost his manhood,
Wow.
due to cancer. And he's in his 60s now, and he came to me and he says, "What can we do?" And so there's different forms of testosterone, but first thing we needed to do is a full blood panel. Find out what his cardiovascular system. Find out again, we're going to go down that same conversation, right? Find out, turn over every stone.
I love it.
Find out what's going on and balance it. Just because you have low T doesn't mean giving testosterone is the answer ultimately for a lifelong change.
Meaning it might help, but it's not necessarily.
Might be temporarily, but might not be fixing the
Mhm.
cause of the problem.
Mhm.
And that's what we do in our clinic. We like to go after the cause if we can. Now, this gentleman, he'll be on T for the rest of his life because he can't develop it.
Mhm.
But let's just say things are changing for him in a positive way.
Right.
He's doing very well.
Well, that's awesome. So I got a question. I'm just going to pretend I'm a patient, or I'm
Okay.
going to be, or a client. How I don't know. What do you guys say? Patients.
Let's role play.
We'll role play for kicks and giggles. So I'll be like, all right, I come in.
Yeah,
exactly.
Yeah.
I'll say, you know what, to be honest with you, Dr. Jeff, I'm struggling with, I'm just really tired. I'm 46 years old. I feel like it's hard for me to focus. I'll do something for a little bit and then I'll do that. It's like I'll see a squirrel and I'll go over here and then I just said, I'm gonna go take a nap. I just feel like that's where I'm at. I'm just losing focus and my energy just keeps dropping. I'll have like maybe a 3-hour, spot of energy, and then I'm just kind of done for the day.
Understand.
Mhm.
So what I would do is go down the consultation path and just start doing PQRST, find out what's going on with you, look at your history, look at your sleep habits, look at your diet. I've been a nutrition since 12, so I always focus on the nutrition because I believe what you put in your mouth, your body expresses.
100%.
So alcohol, smoking, if you're drinking a lot of coffee all day long, we got to look at the whole picture. You got to look at the person as a person, not just the fact that they have a lull in energy. And then at that point, find out, when's the last time you had lab work up? What did they do? Who did it? Generally, if it's a medical doctor and it's just a GP, it's limited. So at that point, discover what do they want? What's their goal? Me and my dad was a dentist, right? And he taught me, he said he was very successful when he was alive. And Dad, how did you go from one clinic to two? He says, son, I just found out what they want and gave it to them if I could. I said, okay. He says, yeah, I just asked them. Find out what they want.
Wow.
He says, but don't give them something they don't want because even if it's the best thing for them, because it's not going to make a difference for them. You gotta understand what they want and then give that to them and then allow them to come to you for the rest. So, what's this gentleman's need? We got to look at, does he have a family? Is it affecting his work? Is it affecting his workouts? What are his goals? So you got to learn the
I
person.
love it.
You got to learn the person, Mark. It's everybody's an individual. That's what you said, and it's so true. And for us to put everybody in just like a can situation or a can treatment protocol, it's not the way I practice. I just don't believe in it. It doesn't matter if it's chiropractic, physical therapy, neurology. My fourth thing I was working on was neurology. So one of the things I would work this up is I'd go into the neurological pattern. I look at the adrenals. When is he lulling? It could be so many things. But when we talk about testosterone, it definitely, even if they're in their 40s, you want to look at that stuff. You want to make sure it's healthy.
Wow. So would you say you spend maybe 5 minutes, 10 minutes with a person to find the problem or what they're struggling with?
No, in my office, it's a 30-minute block out.
Wow. See, I'm not even used to that. I'm used to going to the doctors. If 7 minutes is the max. If we're doing 7 minutes, I think the bell's going off in the background and I get a free cup of coffee. It's just real quick and they give me my pills and boom, and then I don't end up taking the pills because my wife, she's hardcore. She's like, okay, wait, that's going to mess with your liver.
Yeah.
So
amen for your wife.
Yeah, I know. She's a blessing. So it's interesting. You spend 30 minutes with somebody. So what it sounds like to me, and again, correct me if I'm wrong, because I'm wrong a lot, but when I'm right, I go for it. Is that you really focus on trying to find the root of the problem and seeing, instead of just giving a quick diagnostic and saying, oh, it's this, and then here, take that.
And being a doctor, we went through, many years of education. And one thing they drove home repetitively, and even in state boards, is differential diagnosis.
Huh.
Oftentimes as we get older, I think in our practice, all physicians, if we're not careful to do this, we fall into the rut of see this, so we think it's that, so we do this, right? And it's easier to roll them through and it becomes a number. And I would rather not do that. I'd rather find out that I can't help somebody and refer them to the right than try to take them on and make them a failure in my office and me as well. I think it's just really important to reach the people's expectations. And I have had many patients say to me, they've learned so much in the 30 minutes they were with me. And I said, whether you become a patient or not, whether I can help you or not, if nothing else, you're going to be smarter when we're done for today. And I just educate. My mom was a retired teacher, so I enjoy
Hey,
teaching.
oh yeah, she got you. No,
Yeah.
so what's interesting, what bogs my brain, maybe you can help me out with this, is why does it seem like 95% of the doctors out there, and I'm not picking on anybody, why does it just seem like it's a quick revolving door and there's not enough time spent on really wanting to find the root, but just put the patch on there?
Well, I won't answer for those doctors, but I'll give you what I think. It ends up being a money mill. How fast can you get them to go through? How quickly can you get to the next patient? And I think money is the driving factor. Insurance companies are the driving factor. And I don't know why they do it. I just know that I think you're pretty accurate. I have nurse practitioners that work for me, and they're part-time, and they tell me how exhausted they are at the end of the day on just rolling people through. Then they have to go through and do 2 to 3 hours of note taking at nighttime, to cover all that they did. And I understand that bonus structures are important to drive the people, to drive the nurse practitioners, to drive the doctors. I just have to go back to follow the money. I don't see a lot of patients, but the patients I do see, I value each one of them, and really want to give them the quality that they deserve.
Wow.
Some people want in and out, and there are chiropractors that do that, and that's okay.
Hey,
Some men's clinics, they just want in and out, and that's okay. But man, when you're as a physician, when you're in there, make sure you rule out other problems so that you don't cause more. I'm just saying.
Now, I have to ask this question. Do you think they know that, or do you think they're just be doing what they're told?
I think anybody who has a conscience and an innate intelligence
I love it.
knows what they're doing.
Right.
And then they get caught up in the trap of, which way do I go? Feed my family, or find another job, or find another career. And I think a lot of doctors, sincerely, I really think a lot of doctors are passionate when they go into practice. They want
100%. You have to be.
They want to fix the testosterone. They want to fix, the hormone problems. They want to, the endocrinology. I really believe all of them, really, not all of them, okay, 90%, really have a passion for helping people, but they get
100%.
caught up in the business side of it. And that's something that I was told early in my practice to guard from. Protect myself from falling into that.
Oh, well. Okay, awesome. Yeah, sorry to go off on that tangent there, but
It's okay.
back to good old TRT on testosterones. I know there's different type of testosterones, and it's interesting. I hear from certain people, pellets work the best. The cream works pretty decent, but you know what? The injections work the best. So like, I don't even know. I just know that there's so many different types of apples of doctors that will say which one works better. But does that just depend on the person, or what?
Yes.
What do you see in this?
So Mark, let's role play.
Okay.
Mark, I understand that you're in your 40, you're 43 years old, you only have about 3 hours of energy time. What is it that you would like from me? If I could do any one thing to help with that problem, what is it you would like from me if I could help that? If it's possible, I don't know if I can, but if it's possible, what would you like?
I would love to go back to working 8 to 12 hours a day and still have energy like I used to.
Okay. And the weekends.
Exactly.
And the weekends. Okay.
Yep.
All right. So now let me give you some options. Let's just say we've got labs in, say testosterone's low, we need to supplement. Okay. So look, I've got 3 different things that we can do here. And one of them hopefully is for you that you will like. We can do a cream, where you put it on, once, twice a day in certain areas, and you just do it daily. And what that'll do is that can get you up to speed slowly over time and help to give you a nice balanced endurance of testosterone, energy, endurance. It sounds like that's what you're looking for. However, you've got the injections. If you don't mind coming in once a week or injecting yourself, you can do injections of testosterone, and we'll find out how much you need, what's best for you over time
Right.
of trial and error. And none of it's going to be bad for you. If we do a little too much, you just might feel a little this. If we do a little too little, we're not going to get you where you want to be. But with the injections, what we have to monitor, and your subjective conversation with me when you come in each week for a little while, is to find out, do you like highs and lows? Because with injections, if you're doing them once a week, there's a high. Boom, you might wake up the next morning with a pup tent, you know, and you're like, and you're like, oh, what's that? Oh, okay. But generally, what I have found, even doing testosterone myself, is near the end of the week, that I start to feel the ups and downs during the day, not as strong after the first, second, third, fourth day.
Mhm.
And so then you start to drop down into the lull, and then you get, and so highs and lows. Some people are good with that. Some
Mhm.
people are good with that. The guys that go out and they want to power lift and body
Right.
and stuff like
See
that.
results. By the way.
Yeah, generally those guys are wanting those, right? And then there is pellets. So the pellets last 3 to 6 months roughly, and they do a little incision. Usually it's in the buttocks, and they'll put some pellets in there that are time released on a daily basis. Some people like those because they don't have to go in and out. Time is important to them. They can't get in and out. They don't like needles, whatever it is. They don't mind a little incision and drop the pellets in. However, at the end, you'll start to see the lulls, and you'll go back in and you'll get, some people like those. So really, Mark, it's up to you. Which one would you prefer if we were to choose one of these to help you with?
I want the ones where I get the fastest results, which might be the injection once a week.
Okay. So with that being said, I did the same thing, and I got the injection. And of course, the next day I got a pup tent, right? And
I love it.
without being
Right.
rude,
Yeah. Yeah.
right?
Yeah. You were strong.
Yeah, yeah. And I was strong all day in my other muscles too. My
Wow.
endurance, the focus, my clarity was there. So testosterone helps with the mental
Really?
state.
Wow.
Absolutely helps with the mental state of focus, and that constant drive all day long to produce and get things done. It really, really helped. However, I didn't like the highs and lows. So what we do in my clinic is we do functional medicine as well,
Mm.
and we find out, okay, why is it dropping off in the 40s? That's not really a common thing. So we look at the other parts of the person's life. Do they have digestive disorders? Are they not? And so many different ways we can
Mhm.
go. But we look at the other areas, and we look at, okay, so estrogen's off, progesterone's off, this is off. So let's see about balancing that out. And right now, Mark, I don't do testosterone at all. We were able to actually balance me out. Not everybody can do that. Not everybody wants that.
Mhm.
But that is something that patients can look forward to.
Oh, wow. So from your experience, would you say that that more people normally want the injection or just the pellets or the cream? Have you
Injection.
noticed injection a lot?
Well, yeah, they're the same thing. We want it now. No big deal. Let's make it happen. I think capitalistic, thoughts, we get things done yesterday, right? And however, some people are like, I'll come in every week. No big deal. Other people are like, they're traveling. They're their work, they're traveling. They just don't want to come in that often. So we can graduate them to other things. It's not once they start something, they have to stay with that. If you can change it up, just have to have the right physician in front of you to know how to do that safely and effectively for you.
I've heard a lot of doctors say this to other people. I've never heard a doctor say this, but from other people that take it, they're like, yeah, man, when you get on that testosterone, you don't want to get off because it could really mess things up, complications in your body. Is that true? Or is that just them talking to try to keep them
If
on the juice?
And I can't answer for others, but I can answer to the question. I think realistically, there is some truth to that, um, but it does depend on what your goals are, right?
Mm.
So, to get you on it, to keep you on it, you might want that vigor. But there are some dangers too, because you have to look at the liver. So you need a physician about every 3 months is going to come in and do the blood workup again.
Mhm.
You want to look at the other chemistries and make sure they're not faltering. One of the things that I saw in myself and some of my other patients is, we had them on testosterone. They were feeling good, feeling good, feeling good, feeling good. And then it just seemed like we had to keep up in the dose and not getting the same results. doing blood work, we found out that the testosterone was turning into estrogen. So these men were having now more female hormones, and that is also dangerous for the prostate. So you got to,
Okay.
yeah. So you don't want high estrogen. So here I'm pumping myself with 1 cc every week. Da, 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 da,
I think
da,
cold turkey
I'm feeling
stop.
good. I'm feeling good. And I'm not, and I haven't really changed my lifestyle. And then we look at the blood workup and we find out that the estrogen that's down here has now gone the opposite direction. What happens if the body isn't balanced out, handled correctly, and all hormones are functioning the way they're designed? That testosterone aromatizes is the word, and it starts to become estrogen. And men don't want that. And so that's where you have to kind of go, okay, what do we do with that? And you start fixing it with other natural ways to be able to balance it out. And that's what I had to do. My PSA went up, wasn't healthy, and we realized that was why. And now we're good.
Nice. So I don't know how true this is. I also heard that the pellets are made out of a plant-based, so it's basically it's exactly what is created in the testosterone in our body, which is plant-based. They say it's identical. Is that true, or is this just something that some doctors are teaching?
Well, it's called bioidentical, and I don't have all the biochemistry on that to be able to answer that comfortably. If that's the only one, and is it always true?
Okay, yeah, because I was told that, yeah, it's like identical. It's they can't explain it why it's pretty much the same, which is kind of close, like a plant, really.
No, that's bioidentical.
Okay.
So you want bioidentical. Whenever you get into pharmaceuticals, you get into that which is not bioidentical, there's always a side effect. Always a side effect. And so with the bioidentical, yes, it matches the body's same chemistry of an atom and or a molecule. But as soon as they change it with a carbon atom and a hydrogen or oxygen or something, and they've altered that, it's no longer bioidentical, and it will have side effects. And so you do want to go with bioidentical, whether it's from the plant or other
that makes
substances.
Sense.
Yeah.
Oh wow.
So I was going to say, and it's the same thing with progesterone. And a lot of people do progesterone to balance themselves out. You want bioidentical, and it can come from different places.
Oh wow. Yeah, would you say that testosterone is still something that we're learning of the effects of what other things that it can do within the body, or would you say that we've been hitting that nail pretty strong for the past 20-30 years?
I think there's always something to learn.
Yeah, just like stem cells.
I wasn't going to go there, but yeah. Always, even in chiropractic, there's always something to learn. There's over 128 techniques just for chiropractors to use to get the same result.
You know what? You're right about that. I have to tell you this real quick. You brought that up, so you brought up memory. I was at my chiropractor yesterday, and they had a new lady come in. So I'm old school. I like to have the same person every week I'm working with. And she's a new lady. And I'm like, okay, well, I'll just give it a shot. So of course I'm kind of tense because I'm like, I don't know her style. Each chiropractor's got their own style. I just seen it, right? And so she's doing something a little bit different. She's got me in this like MMA hole, And she's like, okay, you're real tense. I go, yeah, I don't know your style. She goes, just relax. She goes, you're going to laugh. She goes, I need you to move your right pinky toe. Like a dummy, I move my right pinky toe and she cracks me. And I'm like, that was good. She goes, yeah. And then she did the next one. She goes, okay, move your left foot. And it's funny because it actually got my mind off of feeling so restricted. So when I move my left foot, anyways.
That's
I've never had anybody do that for me. I've had different things. I've had people throw me against the wall. I'm just joking. But other than that, I love chiropractic. And the interesting thing is, I know we're not really talking about chiropractic, but you do a lot of regenerative medicine. That's how I got into doing what I'm doing as in this show. I had a slip disc. I slipped on the ground on some oil that I did not see, and I was out of work for a year, and I couldn't sleep on my bed whatsoever. I had to sleep on the ground because my back was in so much pain. I went to rehab for your body, working your
therapy.
weights, therapy. I just call it rehab because that's what it feels like. And so I was like, I'm getting worse here. And then finally, a friend of mine, not the smartest tool in the shed, but I'd say in this one he said, Mark, you should see a chiropractor. I go, a chiropractor? Come on. He goes, just trust me. It was like a Seinfeld issue. I got the best chiropractor, everyone's got the best chiropractor, So I go to this chiropractor and he was like, all right, I want you to do this and see me twice a week. We'll get you up and going. Within 60 days, had no back problems. And to this day, I don't have any more back problems. I was getting the soreness, the pinch nerve, the numbness,
right,
because of a chiropractor. And then as I started going deeper with chiropractic, a lot of them are in neurology. They're neurologists. They're in this regenerative medicine. They're taking it to another level where I feel like we've stopped. I'm talking as in the world of doctors, we've stopped. And what I mean by that is there's two types of doctors, actually three. If you're in a car accident, you want that doctor. Okay, you want that doctor. That's one doctor. He's a good doctor. Then you got the second doctor where you come in, hey, I'm struggling focusing and not enough energy. Well, hey, take this pill. The only difference is when you take this pill, you're not going to be able to get pitch a tent for about 3 months, and you're going to be numb in your left nipple. I'm making this up. My point is that how it is
I know
whenever you
that
see,
guy.
yeah, when you see on TV, hey, you could take this pill and it'll take away all your headaches. And at the end, it's like real fast. Yeah, but you can also lose loss of hearing.
Yeah.
So it's like that. That's the type of doctor putting a patch on it.
Right.
But the type of doctors I love are your people like yourself that spend the 30 minutes to 40 minutes, whatever it is, to turn over every stone and figure out how can we help you have a better life. And I feel that that's what we're missing. And we need to go back to that. I mean, literally in the 50s, it was like that. They would go to your house with a bag.
I have one still.
No way.
I do.
Hey,
I believe in that old philosophy. I've done house calls for people.
But you know what? If it's not broken, why fix it? And you know what? You're ready in season, out of season. That's the cool part.
Say that again.
You're ready in season and out of season.
Yeah.
That's the cool part. And we have to,
yeah,
with whatever we're doing. But again, I just want to say thank you so much, Dr. Jeff Frost, for being here. You're a blessing to the community with what you do. When I first saw your website and all the information that you do to focus on helping people, I got really excited. So people out there in internet land, what I need you to do, whether you're hearing this on Spotify, make sure you download this, because you can download it. You can listen to it while you're on your university wheels. That means in your car, or you can go to azregenmed.com, azregenmed.com. Make sure you say hello to Dr. Jeff Frost and say Mark Anthony sent you. That'd be a beautiful thing. But again, thank you so much.
Very welcome. Thank you for having me, Mark. It's been a blessing. Appreciate you.
No, of course.